everyone, welcome to MedTech World, and once again we are here from Malta, from the MCC. I have the pleasure to be with Mr. Cliffort Caruana, who is going to talk a bit more about robotic surgery happening at the moment in Malta.
Correct. So robotic surgery was introduced in our hospital, Mater Dei Hospital, back in 2023. So we started with urology, where we have a urology consultant surgeon who started with prostates, and now he has been doing quite a few, almost 2 a week. Then we expanded to general surgery with upper GI and lower GI. So with upper GI, after intensive training, we've been performing major resections such as esophagogastrectomy, pancreatic surgeries, and from the colorectal side, our colleagues in colorectal have been doing a lot of pelvic work, where we have rectal and sigmoid cancers. We obviously have plans for the future, and that is what we intend to do in the coming months and years, to expand the service, having more surgeons trained in colorectal surgery. We intend to get the trainee console as well, so that we'll be able to train our junior doctors and hopefully opening training opportunities for also trainees from abroad. And obviously enhance the equipment we already have with the Vinci system to have the latest technology. So as you know, robotics is a very fluid thing, so you get developments regularly. So we have to keep up to date with the new equipment, and obviously that would mean more investment in monetary terms as well. So
Yes, earlier the year we got a report, and Mater Dei said you had around 100 surgeries, robotic surgeries last
Correct.
year. What are the plans for this?
So the plan is to increase that number to 300 a year, with the intention then to buy the second robot and be able to perform even more surgeries. The problem, obviously, the robot is not like a small device. It occupies a huge space in theater, so we will obviously need to modify to be able to introduce the training console as well. So there are a lot of restructuring that will need to be done to the theaters that will be hosting the robot. So there's a lot of work that we'll be seeing at Mater Dei in terms of robotic surgery.
Malta is becoming indeed a hub for medical devices and digital health. So how are we preparing in terms of regulations? Actually, we were talking about it.
Okay, that is not an easy question for me, because obviously, in terms of regulation, these are not done from the hospital. So the regulations are all set up from the Medicines Authority, etc., etc. But as a hospital, obviously, we keep up to date with what is happening in bigger countries and make sure that the service that we provide to our patients match, or hopefully be even better than what other patients are getting in other countries.
Thank you very much, Mr. Clifford, for being with us, and hopefully we can see you in MedTech Malta later in the year.
You will definitely see me.